Hello, welcome again to my channel Inspire Pharma. In my last video, I have described about the various principles of the pharmacokinetics. I have described about what is pharmacokinetics, that is movement of the drug inside the body, and I have also discussed about there are the four principles of the pharmacokinetics, that is absorption, distribution, metabolism, and elimination, which is known as combinedly ADME. Okay, so after the distribution, after the drug get distributed in the various organs and the various tissues, what are the next phases, or what is pharmacodynamics? Okay, so it's very important to understand that what is pharmacodynamics, because it is one of the another main part of the pharmacology, because whenever we are administrating the any kind of a drug, we required that that particular drug reaches at the site of action, and after reaching at the site of action, it shows the required pharmacological action. Suppose if you're taking any particular kind of a drug to that can reduce the acid level in our body, so we want that particular drug to reach at the stomach. We want that particular drugs to bind with the parietal cells present in the stomach, and that drug is able to reduce the gastric acid level in our body. So after the drug is distributed, it reads at the site of action. Suppose if we want it to reach at the liver, we want a drug to reach at the lungs or the kidneys or in any other kind of a part. We want that drug to get reached at that part, and after the particular drug reaches at that part, it binds with the number of regulatory proteins which are present on that particular site. Okay, so it will bind with that. That regulatory proteins can be the receptors, that particular regulatory proteins can be the enzyme, can be the ion channels, or can be the transporters. So if a particular drug wants to bind with those regulatory protein, वो bind करना चाहता है उस receptor के साथ, उस enzyme के साथ, या ion channel या transporter के साथ, it must have that binding capability which is known as a affinity. Okay, so if as we say that some drugs having the more affinity than the other, it means those particular drugs have the more binding capacity to bind with the required molecular target as compared to the other drugs. Okay, so that's what is a affinity. So after a drug binds to the molecular target, it shows its required mechanism of action, because suppose if a particular drug is bind with the receptor, it form a drug receptor complex, but it must be fit in that receptor. अगर एक ड्रग को किसी रिसेप्टर के साथ बाइंड होना है, एंजाइम के साथ बाइंड होना है, तो उसको इसके साइज का होना चाहिए ताकि वो उस पर्टिकुलर रिसेप्टर में फिट हो सके, है ना. तो after the binding to the molecular target, form a complex. That complex slowly release the drug and shows the required pharmacological action, which is response to the drug. So that is efficacy. So pharmacodynamics is slightly easy to understand than the pharmacokinetics. Means एक drug distribute हो गया, उसके बाद वो various organs और tissues में जाता है, जहाँ जहाँ पे भी वो site of action पे जो उसके molecular targets होते हैं, वहाँ उनके ऊपर जो भी receptor enzyme होते हैं वहाँ पे जाके bind करता है. Bind करने के बाद वो slowly drug को release करता है, और वो drug अपना pharmacological action show करता है. So that's what is the pharmacodynamics phases. So I hope आपको ये समझ में आया होगा, आपको पता होगा कि फार्माकोकाइनेटिक्स कैसे स्टार्ट होती है. पहले ड्रग एब्जॉर्ब होता है, सॉरी एडमिनिस्टर्ड, फिर एब्जॉर्प्शन होती है, फिर डिस्ट्रीब्यूशन होती है, फिर वो साइट ऑफ एक्शन पे जाता है, वहां पे जो रेगुलेटरी प्रोटीन्स होते हैं, रिसेप्टर एंजाइम्स आयन चैनल, उनके साथ बाइंड करता है. बाइंड करने के बाद वो अपना रिक्वायर्ड एक्शन शो करता है. सो दिस इज द फार्माकोलॉजी. Pharmacology is a mixture of the pharmacokinetics and pharmacodynamics. So in this whole flowchart will help you to understand about the complete movement of the drug in the body and what drug actually does with that drug. So whole is completely in this picture. इधर साइड में उन्होंने pharmacokinetics का बनाया भी है और नीचे pharmacodynamics भी बनाया है. So इस फ्लो चार्ट से आप completely बता सकते हो कि ये pharmacokinetics होती है, ये pharmacodynamics होती है. So I hope my this video will clear your understanding about the pharmacokinetics and pharmacodynamics. So I will explain some other starting topic or initial definitions of the pharmacology which are very important to understand before going to the classification of the drugs. or drugs against any particular disorder or disease, we must understand those definitions. So I hope to clear those definitions in my next few videos. Till then, keep supporting my channel Inspire Pharma and keep sharing my videos. I hope you will support me like you always support. Thank you. We will meet in our next video with more knowledgeable and interesting content. Thank you.